Changing the pain before it reaches your brain. When other treatments fail, spinal cord implants are bringing relief to people dealing with chronic back and leg pain. See the difference it's making for one young woman whose pain started when she was just a teenager. Good morning. I'm Alexis Del Cid in for Jessica Lovell. Welcome to the Morning Medical Update. Back pain can be debilitating, and it's something Catherine Adams learned when she was only 14. Janine Kiesling shows us how doctors at the University of Kansas Health System not only treated her pain, but ultimately helped her achieve her dream of becoming a doctor herself.
Dr. Catherine Adams has been dealing with chronic back pain for more than a decade, but when her pain was going to force her to give up her dream of becoming a doctor, she found a doctor across the street at the University of Kansas Health System who had a new approach that gave Kat new hope.
My life has definitely not been normal.
Growing up in Manhattan, Kansas, Kat Adams was an active teen into cheerleading and gymnastics, but overnight her life completely changed.
I woke up with just this horrible pain down the back of my leg. I was very active growing up and I couldn't straighten my leg without crying.
A disc in Kat's lower back was herniated, and she soon learned she had degenerative disc disease. Kat had 3 surgeries that following year, but the pain didn't subside. Over the last decade, Kat had managed her pain as best she could, limiting her activity and her life.
I didn't realize how much it was holding me back doing all the things that regular teenagers and young adults wanted to do, even in college.
None of that bothered Kat until she finished her 2nd year of school at KU Med. She knew the physical demands of a 3rd and 4th year med student wouldn't be possible unless something changed.
It was definitely daunting. I don't believe I would have been able to make it through.
Kat sought help from Dr. Lateef, who had been treating Kat since she moved from Manhattan, Kansas, to attend KU Med. He suggested a new trial that might just help: spinal cord stimulation. A device is implanted near the spinal cord, and a remote controls the frequency of the pulses sent to the spine to relieve pain.
The moment it really hit me was after they had removed everything, and I said, wow, I really noticed a shift in between when I had the stimulation leads in and when I didn't. And I hadn't had that much relief since I was in high school.
After her 1-week trial, Kat was implanted with a permanent device. She was able to finish med school and just started her residency at KU Med, where she now works with the doctor who made it all possible.
I'm definitely incredibly grateful to Dr. Lateef. From the moment I met him, he was incredibly kind and compassionate and understanding. He was really able to understand what it is that I wanted to achieve, and he had the different options laid out that said, okay, here's the route we can go that we think we can get you there.
We are so pleased to welcome Dr. Kat Adams, a resident here at the University of Kansas Health System. Dr. Adams, officially speaking, you're in your scrubs, so you're working today.
Yes.
Now, for purposes of this program, she's given us the okay to use her first name as the patient, Kat, and you prefer to go by Kat. So thank you and congratulations on making it.
Thank you.
Making it through med school is something most people never do. Right? We are also really pleased to have Kat's doctor, Dr. Usman Lateef, who trained in anesthesiology at Johns Hopkins University, then specialized in interventional pain management at Harvard. Dr. Usman works in our pain clinic alongside, thank you for being here, alongside Katie Fry. Katie Fry is an advanced registered nurse practitioner, so thanks for carving time out of your days to help us educate the public, and thank you in advance for sharing your story. You've had the spinal cord implant, Kat, for 2 years now, and I see you've got your remote control for it right there. We'll get to that in a moment. How are you feeling today when you wake up and come to some place like here?
It's a little nerve-wracking.
That won't handle that, but the remote control won't help with that.
Yes, but I feel great. I've been able to successfully complete my medical school education. I'm able to go out with friends and go travel and walk around in places where I previously need to take a lot of breaks, or I might not even want to go out because I don't want to hold other people back from having a good time. So I've been able to do everything I want to in life, and that's something that hadn't previously been possible before I got the implantation.
And was it instant relief?
I would say it took a little bit to recover from just the procedure itself, and there was an interim period where I had staples, but once I felt fully recovered, I could really see a difference. And even now, I can tell when I'm not as diligent about charging, I can really tell, oh wow, this feels a lot worse than normal. Why is that? And I think, oh, I haven't charged myself, it's dead.
Okay.
And so I can still notice the shift even now when I have that pain relief and when it's kind of more aggravated.
And we'll talk about how you charge yourself. The way you say it makes you sound like a robot. Gotta
Yes.
charge myself. But we'll get to that in a moment too, so put a pin in that. I want to talk about the age component because so many people watching, a lot of us think of chronic back pain as age related. You don't think of it happening to a 14-year-old. You were so young, Kat. You were diagnosed with degenerative disc disease. Any answers as to what caused that in a 14-year-old?
So it was partially genetic. I was adopted, so we didn't know a lot of my family history. And then part of it was environmental. I did a lot of high impact sports, gymnastics, cheerleading, dancing. And so they kind of came to the conclusion that it was a combination of all those things that contributed to what happened.
And Dr. Lateef, do you see this happen commonly in young people who do high impact sports like gymnastics and what have you?
Yeah, I think we see a lot of that. We see a wide range of ages in our practice. Obviously, your body takes a lot of wear and tear over time, and so a lot of our patients are a little bit older. But I have the entire spectrum from teenagers up to people in their triple digits. And a lot of times for the younger patients, it's some type of injury. It could be a car accident. It could be that they did gymnastics, some type of sports injury, or a lifting injury, something like that. So,
Katie, is Kat the youngest?
I think there was one time I saw a 16-year-old, but
Okay.
I think, and I didn't meet Kat until later. Actually, I saw her post-implant is kind of when I started seeing Kat.
Okay, and the fact that, I mean, you're not doing high impact sports for very long by the time you're 14. It could have
Yeah.
only been, when did you start gymnastics?
I must have started when I was 8 or 9, got
Okay,
into
so-
cheerleading in high school.
That much time could have contributed, just
Yeah.
that window of time. Dr. Lateef, I want to get to the nitty gritty on how the implant works, and we have a really cool animation to show our viewers. Can you talk us through what's happening in the spinal cord here?
So when you have pain, those signals are transmitted along nerves to the spinal cord. And in the posterior part of the spinal cord, there's an area called the dorsal column. And I like to think of that kind of as the pain highway. And that's where those pain signals travel. And the stimulator places impulses along that pain highway to kind of clog up the traffic, to make it harder for those pain signals to make it to your brain. And at the same time, it also has some local effects at some other types of neurons there that have inhibitory action. So they actually inhibit pain right there locally at the spinal cord as well. So through two mechanisms, you're able to reduce pain using the spinal cord stimulator.
And then, Kat, you have your controller, and I want to show our viewers this. It just looks like something you would control your ceiling fan with or your TV. Do you carry that around with you at all times?
No, I actually had to dig this out because I haven't used it in such a long time because I've had such great relief. It has some pre-programmed programs in here that I can cycle through, and then I can change the intensity with these little buttons. And so I've had great relief in the last year and a half since I found a solid program that I actually haven't used the remote in that long.
You set it and forget it?
Yeah.
So do you have your own setting, just so I'm understanding it, and it's working right now?
Yes.
In you, and whatever it is, it's perfect, and you've worked that out with Dr. Lateef and Katie, and so you've got that plan.
Yeah.
And then when you say you charge yourself, what does that look like?
So it's kind of like a little flat whoopee cushion that I can stick where the permanent device is, and I can just sit on it. So I can do it when I'm watching TV, when I'm driving to school. It's really easy, which means I should charge myself more often, but I'm a little forgetful sometimes. So it's really convenient. I can just sit on it for as long as I want.
And how long does it take to be fully charged up then?
If it's completely dead, maybe an hour and a half, 2 hours. If I'm pretty diligent about charging every day, it can be 30 minutes to an hour every day.
We have video, Dr. Lateef, of you implanting one of these devices in a different patient. This is such a cool thing to watch. Explain to us what we're looking at and what you do during a typical surgery.
Yeah, so just to be clear, so usually patients will first get to try it out for a week without any kind of incision. Just through injections, we place the leads, take the needles out, tape everything in place, you try it out for a week. If that works really well, we can go to surgery where we put in a permanent device. It's a pretty minor surgery. We make 2 small incisions. One is by the back, and then through that we place the 2 leads. We anchor them in place, we run the leads under the skin to another incision over in the buttock where we place a small generator which also has the battery in it. And it's a pretty small device that just goes kind of under the fat of the buttock. So when it's done, there's just these 2 tiny incisions, and they usually heal up pretty well, and there's nothing that's sticking out externally.
We have an x-ray as well to share with our viewers. It's an x-ray showing, Kat, it's showing your implant. So what are we looking at here, Dr. Lateef? What are those arrows pointing to?
So those are essentially the leads. So you can see there on that picture on the right side. On the left side is kind of her back or her skin. On the right side would be kind of like her abdomen. And you can see that bottom arrow is kind of where the leads are going in and then entering into that spinal canal. And then they're running upwards kind of to the thoracic region around T8, T9, T10. And that arrow at the top shows the leads in place, and you can see little, almost looks like a dashed line. Each of those are a contact, and there's 8 contacts on each lead, and there's 2 leads, and they're a little bit staggered. So that gives us 16 different spots that we can stimulate the spine at.
Katie, Kat says this surgery changed her life. It really gave her life back. How does it feel to be sitting next to a patient who's a doctor now saying that this is what saved her?
I honestly kind of teared up during your video. That was pretty amazing. I think patients are often scared about permanent implants for good reason. It's minimally invasive, like Dr. Lateef said, but it's still a permanent implant. But I tell people this can change lives, and it can make you more functional, so you can go to your grandkids' baseball game and just be able to feel normal. So hearing great stories like Kat's is encouraging and makes you want to share it with everybody else.
Is Kat's story typical, these kind of results? So that's a typical?
I feel like there are patients all over the spectrum for sure. What we aim for is 50% reduction in pain as well as improvement of functionality. So I think if we can get anywhere within that, it's life-changing for people. So that is what the expectation is for a good trial.
Is getting the implant a last resort or a first resort?
It's a good question. There's new literature that's coming out that says actually the sooner we can get implanted and with stimulation, people typically can do better. But previously, over the last probably 5 years, Dr. Lateef can correct me if this is wrong, I feel like it was only for patients that had pain after back surgery. But the game is changing, and high frequency has been able to do that.
Yeah, we've really expanded the indications that can be used for. There's very strong evidence showing the efficacy of the specific treatment that she has, which is high-frequency stimulation for non-surgical back patients. So even if you didn't have to have back surgery, but you're having pain, you can benefit from this. And they've even expanded to things that are non-spine related. For example, there's a very large study for painful diabetic neuropathy. People who have pain in their limbs from diabetes, for which there really weren't a lot of great options previously. And we were actually one of the large sites for a huge study that was done on it, the largest study ever done, that proved that not only can it help reduce pain in diabetic neuropathy, but it actually can regain neurological function. So people can actually feel things they couldn't feel before. And so I think it's just something that just keeps advancing. It's not something where, you know, if I moved a sofa and I had back pain and you come see me 2 weeks later, we're going to go straight to this.
Right.
There's going to be some, you know, there's injections and other things that we do along the way. We make sure you do physical therapy, try some different medications, give it a little bit of time. But once that's exhausted, there's no reason to delay. And there's even some studies that show that from the onset of pain to when it becomes chronic, if you can get it put in within 2 years, you'll have a better outcome than if you wait 20 years. That being said, we see people in the entire range, and the great thing is because we do the trial first, we get a good sense of if this is going to be a good therapy for you.
And is there a specific kind of pain the stimulator won't treat that you just say it's not going to work for your kind of pain? Katie?
With high frequency, they suggest non-mechanical pains, or it does not treat mechanical pain, excuse me. So neuropathic pain is specifically what it treats.
What would be mechanical pain? What's an example of that?
Arthritic changes, and when you're getting up and standing and when having pressure on the back, it doesn't help that. But I feel like I have seen patients, once again, all around, and the fact that if it's primarily arthritic, then they can get really good results with that.
Interesting.
But on label, it's with neuropathic pain.
There are also different kinds of models and makes of the spinal cord stimulators. So how do you decide which one you're going to use for Kat, for example? There's a variety of considerations that go into that. Anytime we're talking about any kind of intervention, I like to have a good discussion of the pros and cons and how it will fit best for
this particular patient that's in front of you into their lifestyle. Some of the big caveats are like one, a lot of the stimulators are non-rechargeable, so that means you just use it all the time. You never have to charge it. There's pros and cons with that. There's other therapies like the high-frequency stimulation, which Kat has, where it does have to be charged, but it doesn't have to be charged every day. It might be charged a few times a week or a few times a month, and as we kind of fine-tune that therapy, we can make the battery last longer and longer. The non-rechargeable ones, the battery has to be changed a little bit more frequently, whereas with the rechargeable ones, they last longer. But the biggest difference, I think, is the types of waveforms that they use. There's probably two manufacturers that we use the most in our practice. And the advantage of the one that Kat has is that it is a non-paresthesia based one, or high frequency 10 kilohertz stimulation, which means she doesn't feel anything when it's on. And when I think about pain, pain is just such an invasive disease. It affects so many dimensions of your life. And I like the fact that this is a therapy that you don't have to feel. And so rather than shifting the spotlight from the pain to the pain treatment, we can shine that light on things that are important in your life and allow you to move forward.
That was the question I had, is if you feel any kind of vibrating or twinging or different other kind of sensation, and there's no other sensation?
No, I don't feel anything. I can go about my day and not have to think about it, and occasionally I'll still get the pains that I had before, but it's at a very decreased amount that it used to be.
And you might have to change out a battery in some models, Dr. Latif. Do you ever have to change out the whole stimulator, or is that just in the person forever?
So, for most people, eventually you have to change out the battery. So if it's a non-rechargeable, it maybe lasts, say, 4 to 6 years. If it's a rechargeable one, it may last 7 to 8 years, and then the battery has to be changed. Okay. Changing the battery is a pretty minor procedure. It takes about 30 minutes. You're asleep. We just make a tiny incision where the generator is and just swap them out, and we can leave the leads in place. It's uncommon that we have to change the entire thing. Now, if for some reason those leads have moved, or maybe you have like a really old device and now you're wanting to switch to a new device and the old one was not MRI compatible, then maybe we might switch the entire thing, because by upgrading both the leads and the device, we can make it MRI compatible.
And Kat, it's just so wild to have you sitting here in your scrubs. You went from a child to a patient, now you're a doctor, working alongside the team that helped heal your chronic pain. That must be such an incredible feeling to be sitting here with Dr. Latif as another doctor.
It's definitely surreal. I'm incredibly honored to work and hopefully call myself colleagues now with these incredible people at KU. And I'm eternally grateful for what they've been able to give me, which is my life.
Katie, must be a rare feeling to see someone who was a patient come through and then be working alongside you.
It's pretty cool.
I can see you started to tear up.
Yeah, she's great.
Video, but it's so emotional. And Dr. Latif, how special.
I think it's just so great to see what Kat has accomplished. It's not an easy feat, regardless of what therapy we were able to provide her and so on. Just to overcome those obstacles and to have this achievement, it's really great. I'm really proud of her. And I think it makes me really happy about our field. This is emblematic of the field of interventional pain. We're dealing every day with patients who are really suffering, and it's impacting their lives, and it's impacting their quality of life, and they can't do things. And often we are able to find solutions that can transform those lives and help them regain their quality of life and move forward. And I'm really proud to be part of our particular group of 9 physicians now in our group that are all practicing kind of at the forefront. So all of the cutting edge technologies that are coming out, all the things that are most supported evidence, we are doing those things. We're often doing those things before they're even publicly available, because we're participating in those trials or helping get them approved by the FDA. And so it makes me really proud to be in this practice, and I could not be happier for Kat and what she's accomplished.
Well, I told our guests before the program that I'd be looking at my phone for questions, not scrolling Facebook, but we are getting a lot of questions already on Facebook and the various threads. So send your question in. You can use the chat on YouTube, Facebook, you can tweet us, you can email the Medical News Network. All the information is right there on your screen. We love your live questions. We also love Dr. Dana Hawkinson. He has our COVID count. Dr. Hawkinson,
Hi.
How you doing?
Yeah, I'm doing pretty good. I'm not really needed too much anymore, however.
We always need you.
Which is a good thing. It's a good thing. Right now, 9 total, but only 2 active, and I don't think we have been at the level of 2 active cases for more than a year. Maybe almost 2 years, but anyways, only 2 active, none in the ICU, none on the ventilator, so that is overall a great thing.
We'd love your thoughts on a new update from the CDC. The CDC says by the end of 2022, 77% of Americans had COVID antibodies from prior infections, which means 3 out of 4 of us have been infected with COVID, some more than once. How does the CDC figure out those numbers, though?
Yeah, and this was a pretty good test done by, or a survey study done by the CDC. They were basically looking and following about 143,000 blood donors, and they started this testing, this survey in January of 2022, and through it all, we have seen that the number of people who were seropositive, meaning they have antibodies to SARS-CoV-2 or COVID-19 did significantly increase, and by the end of it, by December, it was 77% of those aged 16 and over. Now, they also did look at those who had infection, but also those with previous vaccination. But what they found, which was really interesting, was that around the April time mark when they looked, it was about 55% of people had infection-induced antibodies. But by December, it was that 77%. So a large proportion of Americans did have actual evidence that they had COVID-19 infection, which is really interesting. And again, that was in December of 2022. So since that time, we've moved on from there, obviously, and that number could possibly be higher at this point. But they also looked at those people that also had evidence of antibodies from vaccination too. And the majority of those people in that 77% also had some evidence of vaccination as well. But I think it's just interesting to show that by the end of 2022, we did have 77% of Americans who had evidence of actual having COVID-19.
That's a huge percentage.
Yeah.
77. Dr. Hawkinson, thank you. Do we have any reporter questions today? No reporter questions, so we're going to get straight to our community questions because our viewers really have a lot to ask of our experts here. Yen Liang wants to know, could spinal cord stimulator be used to alleviate pain that stems from elsewhere in the body, or is it specifically for spine pain? Dr. Latif?
Yeah, that's a really good question. So I would say the majority of the large studies have been done on spine pain and then painful diabetic neuropathy like we discussed. That being said, there's a lot of other applications for it. We've used it successfully for patients with abdominal pain, people with pelvic pain, people with genital pain, people with pain in the extremities. So for example, there's something called CRPS, or complex regional pain syndrome, where you can develop chronic pain after some minor injury or after a surgical complication. And in those patients as well, they'll often respond really well to spinal cord stimulation. That being said, this is not the only therapy we have to offer. We also have something called peripheral nerve stimulation, which is a different type of technology that can often be used on nerves more distal in your body and can focus on very specific things sometimes. And so I think the best thing is, if you have some type of pain and you're not sure if it fits into one of these categories, we can kind of go through it and figure out what would be the best therapy fit for you.
We have a few different people asking a similar question. I'm going to summarize it based off of Gene Reardon's most recent question. If preventing pain, and Katie, I'll ask you, does preventing the pain carry a secondary risk then of possibly damaging the spine because something bad is happening in there that you're ignoring?
No, you know what's going on in your body. That is a very common question people ask me. No, you can tell if something is not right. You still have feeling, and that's also the beautiful thing of high frequency, where you don't have any kind of sensation. So no, you absolutely.
Yeah, and I'll add one other thing too.
Yeah.
You know, I like to think about it as two kinds of pain in your body. You have appropriate pain and inappropriate pain. Appropriate pain is like you go to touch a stove and it's hot and so that hurts, you pull your hand back. That saves you from getting burned.
Right.
Inappropriate pain is you had some injury or something happened in your spine and now it's hurting, so now you know, hey, go check it out. But now it's 2 years later and it's still hurting. You already know it's hurting. There's nothing else to be done. That's inappropriate pain. And so this technology works more on that inappropriate pain, but it doesn't do anything to prevent. So if your friend says, hey, let's lift this really heavy sofa, and you know that's a bad idea, when you go to do it, your body's still going to tell you that was a bad idea.
Oh, that's really good to know. That's a great way to explain it. That's a great way to explain it. Have a question from Stu. Stu wants to know if this causes cat problems at airport security.
Yes, I do have a little card that I carry with me, and so I can show to the TSA people that I can't go through the metal detectors or the other specialized equipment that they have. So I just opt out of security and I get a pat down, which is always an interesting time.
Right. Always adds a little excitement to your trip. Sharon wants to know, does insurance help with the cost?
Yes.
Did yours?
So I did have to get insurance approval before this process started, and so based on my history and what I've already tried, they decided that they would cover it, and so thankfully everything was covered by my insurance.
Bruce has a question for you, Kat. This is where all the curious people want, and I want to know this too. Can you feel the implant, Bruce writes? Can you feel it under your skin?
So occasionally I can. It's not deep enough that I can just forget about it. It causes a little bulge where it's placed, and because of the location, I can sometimes feel it if I'm slouching in a chair. But other than that, day to day, I don't notice it.
And how big is it? You said it was small, Dr. Lateef. Can you show us?
Yeah,
is it like
so it's probably
quarter?
about that size. It could kind of fit in that finger if you can kind of see this little ring
Like a
here.
silver dollar?
And in terms of thickness, it's probably about that thick. So it's
Okay.
pretty small. And I'll tell you this too. You know, I've been doing this for a while now, and they just keep getting smaller. So I wouldn't be surprised if next year the ones we see are even smaller than
tinier.
that. Yeah.
That's true. Everything gets smaller with technology. Jeremy would like another explanation of how long this battery will last, specifically Kat's. Jeremy wants to know, will Kat need to come back to swap it out? I know you talked about that possibility in different models.
So it varies, but I would say for the type that she has, 7 to 8 years is probably a reasonable estimate. You know, we've seen them last longer. We've seen them sometimes wear down just a little bit sooner. But even that, I think, is improving over time because we continue to come up with new innovations with the way the treatment is delivered, and so that it goes, for example, like in pulses, so it's not just on all the time. So even though you may have just left it on, it's just giving you little pulses occasionally or things like that. And through that better management, now they've even shown that in some patients you could even go up to 1 month without charging it by optimizing it. So I think that that will continue to improve over time, and that's one of the cool things about this. Just like your phone, you wake up sometimes and it had a new update and it can do new cool things. The device is the same way. It can be upgraded wirelessly.
I have a comment that someone shared on Facebook. Lynn writes, my cousin has a spinal cord stimulator and can't drive with it turned on. Why would that be?
So that usually stems from patients who have stimulators a little bit older or from other types of waveforms. So we talked before about how there's a difference between paresthesia and non-paresthesia. So paresthesia means that if you're using these low frequency tonic stimulators, you can feel it when they're on. So you feel kind of little zingy feelings or kind of funny sensations on your legs or things like that. With non-paresthesia treatment, say like the device that Kat has, which is 10 kilohertz high frequency therapy, with that you don't feel anything at all. So for that one, you can just leave it on all the time. It doesn't matter. The concern would be if you're using ones where you feel things when they're on. What if you're driving and you suddenly moved or turned or something like that, and suddenly you felt a zing that you weren't expecting and it distracted you from your driving? That would have been the concern. But I think that with the Nevro device, which is the high frequency device, that's been completely eliminated. And with some of the other ones, they're starting to make some strides in making some changes so that at least you feel less when it's on, or in some patients maybe even can get the sensation to go away.
It's really amazing technology, and to hear this success story is unbelievable because so many people suffer from chronic pain. So I want to bring everyone back in for today's takeaways. Kat, I want to start with you. What do you want people watching to know most?
I would say there's a lot of options. I was a little hesitant about getting something permanent implanted at such a young age, but I think it was definitely worth the leap. With the trial, there was very low risk, knowing that I could eventually have it removed if ultimately I decided I didn't want it. So there was steps along the way that were there for me.
Katie, what about you?
I think it's important to know that we don't deal with just spine pain too, and one of the questions kind of put that in there too, but that is a very common question that I have with patients. Well, do you also treat knee pain? Yeah, we do. We do a lot of stuff, and I think through those different pathways, and spinal cord stimulation being one of them, that can change lives. And so come see us. I feel like
Clearly.
we don't want you to suffer. We want to take care of you. That's our goal, and hopefully change lives and make things more fun.
It's beautiful to see. Dr. Lateef.
Yeah, I think the biggest thing is it's an evolving field, and it just keeps advancing. And I feel like, especially in the last few years, it has just been moving at light speed. And so I would say, you know, if you have some type of pain issue and you've never had evaluated, now is the time. Come in and let's see what kind of options we have to offer that might fit well for you. You know, even if you've been seen before, things change. I have patients who I saw, you know, 2-3 years ago, and then we kind of had reached the end of the road. There wasn't anything else to offer. And then they showed back up a couple of years later, and suddenly I said, well, this is perfect. Now we have this thing that's exactly for the condition that you have. And then they have a remarkable outcome, and it's great. So I think the first step is to explore your options.
Explore your options, and then You have such a great success story as Kat. Thank you all so much for being here and for taking time out of your busy days. We know you all three of you have patients to see and things to do. And thank you so much to our viewers for being with us today and joining the conversation. Also, before we go, we love sharing baby photos. We're always good for any excuse to share those. Well, Taylor Swift gave us a great idea here. Her Eras Tour comes to Kansas City tonight and Saturday. So our friends in the full-term nursery and the NICU dressed up their patients in outfits inspired by the singer's different looks. We'll see you right back here on Monday. Have a great weekend.
Coming up Monday on the Morning Medical Update.
Mutant genes make some people almost destined to get cancer. One woman decided to change her destiny and had her stomach removed. I'm Alexis Del Cid. On the next Morning Medical Update, the genetic side of cancer and what it means for family members of oncology patients. Monday at 8 a.m.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now everywhere podcasts are available.